2. Psychodynamic therapy. Psychodynamic is a technique of treating mental disorders by psychological means. Secondly, a procedure for the investigation into those human psychical processes which are not accessible otherwise. And thirdly, a psychological theory based on the psychological data obtained from the above-mentioned investigation, which has been accumulated under a scientific discipline emphasizes, in a major way, the unconscious mental processes. Psychoanalysis may be said to be a product of 20th century, with Sigmund Freud's publication of Interpretation of Dreams in the year 1900. Freud, the renowned neurologist and physician of Vienna. Freud himself coined the term psychoanalysis. Freud's two mentors, the Viennese physician Joseph Breuer (1842–1925) and Parisian physician J. M. Charcot (1835–1893), were also associated with the discovery of psychoanalysis. The therapy is practiced into two basic forms: classical psychoanalysis and psychoanalytically oriented psychotherapy. As developed by Freud and his immediate followers, classical psychoanalysis is an intensive, at least 3 sessions per week, long-term procedure for uncovering repressed memories, thoughts, fears, and conflicts stemming from problems in early psychosexual development and helping individuals come to terms with them in light of the realities of adult life. In psychoanalytically oriented psychotherapy, the treatment and the idea guiding it may depart substantially from the principles and procedures laid out by orthodox Freudian theory, yet the therapy is still loosely based on psychoanalytical concepts. For example, many psychoanalytical-oriented therapists schedule less frequent sessions, e.g. once per week, and sit face-to-face with the client instead of having the latter recline on a couch with the analyst out of sight behind him or her. Likewise, the relatively passive stance of the analyst, primarily listening to the client's free association and rarely offering interpretations, is replaced with an active conversational style in which the therapist attempts to clarify distortions and gaps in the client's construction of the origin and consequences of his problem, thus challenging clients' defenses as they present themselves. We will examine Freud's original treatment method, in part because of their historical significance and enormous influence. 3. Freudian psychoanalysis. The term psychoanalysis refers not only to Freud's theory of personality but also to the specific approach to treatment that he developed. The goal of psychoanalysis is to help clients achieve insight, the conscious awareness of the psychodynamic that underlie their problem. Such awareness permits clients to adjust their behavior to their current life situation, rather than repeating the maladaptive routines learned in the childhood. Analysts believe that as the client repeatedly encounters and deals with long-buried emotions, motives, and conflict within and outside therapy, the psychic energy that was previously devoted to Psychology Paper Number 15, Clinical Psychology. Keeping unconscious conflict under control can be released and redirected to more adaptive ways of living. We will describe basic techniques of this form of therapy. 1. Pre-association. 2. Analysis of dream. 3. Analysis of resistance. 4. Analysis of transference. 5. Counter-transference. 3.1 Free association. The basic rule free association is that individual must say whatever comes to mind, regardless of how personal, painful, or seemingly irrelevant it may be. Usually a client lies in a relaxed position on a couch and gives running account of all the thoughts, feelings and desires that come to mind as one idea lead to another. The therapist usually takes a seat behind the client so as not to disrupt the free flow of associations in any way. Freud believes that mental events are meaningfully associated with another, so that clues to the content of the unconscious can be found in the ongoing stream of thoughts, memories, images and feelings that we experience. The analyst does not expect that free association will necessarily lead directly to unconscious material, but rather it will provide clues concerning important themes or issues. Analytic interpretation involves a therapist's tying together a client's disconnected ideas, belief, and action into meaningful explanation between his maladaptive behavior and the repressed events and fantasies that drive it. 3.2 Analysis of dream. Dream analysis placed psychoanalysis from a therapeutic process to full-fledged depth psychology. Dream is the phenomenon where unconscious is demonstrated. In dream, the functions of ID, ego, and superego, and the conflicts among them are easily understandable. Knowledge gained through dream made it possible to understand the patterns of disease as well as normal minds. It was found that the dynamics of the formation of dream and that of the symptoms are same. Dream and disease are both outcome of the conflict among the three, ID, ego and superego. Whereas the dream is temporary and disease continues. Moreover, the dream is a way of fulfilling the unconscious wishes. It has an adaptive value. The tension due to unfulfilled desires are released in dream. Therefore, dream brings the palliative influence on mind. Contrarily, the disease is painful, brings sufferings to the mind and is maladaptive. The knowledge of dream is very illuminating. It shows the mental mechanism, which is responsible for producing pathological state, is also found to be present in normal mind. It is said that the interpretation of dream in the royal road to the knowledge of the unconscious activities of the mind. The formation of dream can occur in two ways. 1. An unsocial or unattainable impulse which, in our waking and real-life situation is not practical and hence is generally suppressed, find its way during sleep to exert influence upon the ego. The ego in sleep withdraws itself from reality. The suppressed material of the waking life finds a passage towards manifestation in dream. 2. A repressed thought or desire may achieve reinforcement during sleep from the unconscious element. That reinforcement may cause the repressed thought or desire to come out in dream by shattering down the resistance of the ego. Understanding of the dream phenomenon has led psychoanalysis to evolve its own particular and specialized technique for the treatment of the mental patients. The dream itself is a state of severe mental disorder, a psychosis with all its complicated network. But it is of a short duration, and with awakening, the ego again comes to a normal functioning. The disorganized ego comes to the analyst for help. The analyst, who represents for reality and at the same time an ally from outside, has to help the sick ego in its fight against its internal psychology enemies. The position of the analyst is like the reality world, which helps the ego in reality testing and in regaining reality sense, after it comes out of illusions and delusions during sleep state with the break of sleep. The analyst and the sick ego work together as a unit, to overcome the pressures of the id and the superego. The analyst helps the client arrive at an understanding of what the symbols in the dream might really represent. Thus a dream has two types of content: 1, manifest content, which is the dream as it appears to the dreamer, and 2, latent content, which consists of the actual motives that are seeking expression but that are so painful or unacceptable that are disguised. 3.3 Analysis of resistance. During the process of free association or of associating to dream, an unwillingness or inability to talk about certain thought, motive, or experiences. For example, a client may be talking about an important childhood experience and then suddenly switch topics, perhaps stating, "It's really not that important," or "It is too absurd to discuss." Resistance may be evidenced by the clients giving a too glib interpretation of some association, or coming late to an appointment, or even forgetting an appointment altogether. Because resistance prevents painful and threatening material from entering awareness, its sources must be sought if an individual is to face the problem and learn to deal with it in a realistic manner. An important task of analysis is to explore the reasons for resistance, both to promote insight and to guard against the ultimate resistance, the client's decision to drop out of therapy prematurely. 3.4 Analysis of transference. Transference is a form of relationship between the patient and the analyst. It is a transference of feelings onto the person of the physician. This relationship crop up is a universal phenomenon during the course of the psychoanalytic treatment. This phenomenon distinguishes psychoanalysis from any other form of psychotherapy. Transference is the pivotal point around which the theoretical and technical aspects of psychoanalysis evolve. Transference is the experiencing of feelings, desires, attitudes, fantasies, and defense towards a person in the present which do not fit that person, but are a repetition of reaction originating in regard to significant persons of early childhood, unconsciously displaced onto figures in the present. Like other psychoanalytic concepts, the concept of transference developed in a progressive way with the maturity of Freud's experience and thinking. He first mentioned it in his book, Studies on Hysteria. He described it as the result of false connection, because old relationships and feelings are transferred by the patient onto the person of the physician through a false connection. Feelings connected with past wishes emerge and become experienced in the present as a consequence of the false connection. Freud thought it to be an obstacle to the treatment, as this relationship gives rise to resistance. And it would be impossible to carry on analysis unless this resistance is met. Freud narrates his first experience with a patient regarding transference as follows: "In one of my patients, the origin of a particular hysterical symptoms lay in wishes, which she had many years earlier and had once relegated to the unconscious, that the man she was talking to at that time might boldly take the initiative and give her a kiss. On one occasion at the end of the session, a similar wish came up in her about me. She was horrified at it, spent sleepless night, and at the next session, though she did not refuse to be treated, was quite useless for work." Transference may be of two types, positive and negative. The feelings and other mental states which are of affectionate type are called positive. It occurs when a client transfers feeling of intense affection, dependency, or love to the analyst, based on past relationships. And those which are of hostile nature are named as negative. Both the types may arise in the patient during the course of analysis. Analysts believe that until transference reactions are analyzed and resolved, there can be no resolution of the client's problems. Psychology paper number 15, Clinical Psychology. In psychoanalytic treatment, it is found that the patient's interest is focused on the analyst and the symptoms of the disease are replaced by different reaction towards the analyst. When this situation is achieved, it is called transference. 3.5 Countertransference. Like transference, countertransference is also a manifestation of the doctor-patient relationship, occurring in psychoanalytic treatment situation. But it differs from the former in that it is viewed from the doctor's total feelings towards his patient, arising as reaction of the patient's influence upon his doctor unconscious. Like transference reaction of the patient, if not handled properly, the countertransference reactions of the therapist, if not properly controlled, may jeopardize analysis. Therefore, the analyst must always be aware of his own reaction and be on guard, and be able, on the strength of his analytical training and insight, to tackle this phenomenon. Analyst's ability in this regard will yield success in his analytical work. So like transference, this can also be regarded as a useful tool in the hands of the therapist. In psychiatric practice, the physician must be aware of the phenomenon in his own mind, because this may lead him, if not properly understood, to wrong diagnosis and management. 4. Interpretation. How can analysts help clients detect and understand resistance, the meaning of dream symbols, and transference reactions? Interpretation is any statement by the therapists that is intended to provide the client with insight into his behavior or dynamics. An interpretive statement confronts clients with something that they have not previously admitted into consciousness. A general rule in psychoanalytic treatment is to interpret what is already near the surface and just beyond the client's current awareness. McWilliams, 2004. Offering deep interpretation of strongly defended unconscious dynamics is considered poor technique because even if they are correct, such interpretations are so far removed from the client's current awareness that they cannot be informative or helpful. 5. Psychodynamic therapy. Since Freud, the original version of psychoanalysis is practiced only rarely today. It is costly in time, money, and emotional commitment. It may take several years before all major issues in the client's life have been satisfactorily resolved. In classical psychoanalysis, it is not uncommon for a client to be seen 5 times a week for 5 years or more. Today, however, many therapists' commitment both impractical and unnecessary. Their conclusion is supported by psychotherapy studies that measure the degree of improvement that occurred over the course of therapy. Psychodynamic therapists are adopting briefer and more economical approach. Like psychoanalysis, brief psychodynamic psychotherapies focus on understanding the maladaptive influence of the past and relating them to current patterns of self-defeating behavior. Many of these brief psychotherapy utilize basic concepts from psychoanalysis, such as importance of insight and the use of interpretation, but they employ them in a more focused and active fashion. The therapist and the client likely to sit together facing each other, and conversation typically replaces free association. Clients are seen 1 or 2 times a week rather than daily. The goal is typically limited to helping the client deal with specific life problems rather than attempting a complete rebuilding of the client's personality. Therapy is therefore more likely to focus on the client's life situations rather than on past childhood experiences and may involve teaching the client specific interpersonal and emotion control skills. One recently developed interpersonal therapy focus almost exclusively on clients' current relationship with important people in their lives. This highly structured and seldom takes longer than 15 to 20 sessions. Therapeutic goals include resolving role disputes such as marital conflict, adjusting to the loss of a relationship or to a changed relationship, and identifying and correcting deficits in social relationship. Psychology paper number 15, Clinical Psychology. That make it difficult for the client to maintain satisfying relationship. The therapist collaborates very actively with the client in finding solutions to these problems and may invite the client to link issues in current relationship, thereby showing that what happened in the past need not be carried into the present. 6. Evaluating psychodynamic therapy. One of the function of the psychoanalysis is to treat mental disorders. With the advent of psychoanalysis, with its determinism in the field of mental disorders, everything doeth minutest experiences, behavior, imagination, thought, fantasy and action, i.e. all symptoms were given proper meaning and appropriate place in the cause and effect chain. The real importance of psychoanalysis rests with the fact that it did not remain confined within the sphere of abnormal mind or mental disorders. It stretched its investigation into the functioning of normal human mind, developing itself as an independent science of human mind. Psychoanalysis has shown in a new way the uniformity of human mind all over the world. Man's joy and sorrow, his love and hate, his fear and courage are similar everywhere. The validity of psychoanalysis as a therapeutic measure has been challenged by many. Among them, Eysenck is the most vociferous. He rejects the efficacy of psychoanalysis altogether, on the basis his research data. According to him, percentage of cure among the patient without the use of psychoanalysis is very high, whereas those in whom psychoanalysis was used are found to be cured in a significantly lower percentage. It is very difficult to assess the result of psychoanalysis properly, because there are no valid and dependable method for assessment of basic psychodynamic variables. It has never been said that psychoanalysis has been able to explain satisfactorily all the phenomena of human life. It is enough for a science that it attempts at explaining the immense number of facts with a minimum number of assumption at the same time, raises new and appropriate questions, invites further application and explanation, and in this way remains open. Thus the achievement of psychoanalysis lies in its being a science, or a scientific method. Classical psychoanalysis is routinely criticized by outsiders for being relatively time-consuming and expensive, for neglecting clients' immediate problems in search for unconscious conflicts in the remote past, and for being no adequate proof of its general effectiveness. There have been no rigorous, controllable outcome studies of classical psychoanalysis. This is understandable given the intensive and long-term nature of the treatment and the methodological difficulties inherent in testing such an approach. There are some promising hints that this treatment approach has some value. In contrast, there is much more research on some of the newer psychodynamically oriented approaches, although research showing that this form of therapy works for specific diagnosis is still generally lacking. 2. Introduction. Behavior therapy comes under the larger rubric of action-oriented methods that help people change the way they think and do things. These are called as action-oriented as they rely on behavior-specific interventions and outcomes. The behavior approach has its beginnings in the 1950s and early 1960s. It started as a school of thought disagreeing and departing from the widely popular psychoanalytic approach. Behavior therapy applied its principles of classical and operant conditioning to the treatment of problem behaviors. Modern behavior therapy is focused on giving control to the clients and help increase their skills to overcome the debilitating behaviors. The theory of behavior therapy is based on the belief that all our values, attitudes, preferences, emotional response, thinking patterns, personality styles, and problems are the result of learned behavior. In this perspective, a maladjusted person is seen as a having failed to acquire appropriate coping skills, b having learned faulty coping patterns which is maintained by some kind of reinforcement, or c both. Human behavior is shaped, reinforced and molded by the world around us. Hence a systematic and scientific approach is used to identify specific behaviors that need to be changed, set desirable and achievable, collect data on clients' functioning levels, design a behavior modification module, decrease clients' resistance, modify distracting variables, monitor the impact of module and made changes if required in the treatment plan. 3. Basic assumptions. It is based on principles and procedures of scientific methods such as learning principles. It states treatment goals in concrete and objective terms. The concepts and procedures are explicitly stated, empirically tested and continually updated. B. Behavior therapy deals with the client's current problems and the factors influeing Them. C. Clients are expected to engage in specific actions to deal with their problems. They monitor their behavior both during and outside the therapy sessions, learn and practice coping skills and role-play new behavior. Thus, it is an action-oriented approach. D. It is carried out in the client's natural environment. It is largely educational. It teaches clients skills of self-management. Homework assignments are integral part of behavior therapy. E. Behavior procedures are tailored to fit the unique needs of the client. Psychology paper number 15, Clinical Psychology. F. The practice of behavior therapy is based on collaborative partnership between the therapist and client. Clients are trained to initiate, conduct and evaluate their own treatment under the guidance of the therapist. 4. Role of therapist. A behavior therapist is active in counseling sessions. Hence, the client learns, unlearns or relearns specific ways of behaving. Counselor functions as a consultant, teacher, advisor, reinforcer and facilitator. She may instruct or supervise support people in the client's environment who are assisting in the change process. The therapist must also model appropriate behavior as he serves as a person worthy of emulation. Hence, the therapist must be aware of their crucial role and power they have in influencing the client's way of thinking. Behavior therapy demands a high level of skills and sensitivity from the client and an ability to form a working relationship with clients. 5. Key techniques. Extinction's basic principle of extinction involves elimination of reinforcement for the maladaptive behaviors. 2 specific techniques that rely on the principle of extinction are implosive therapy and flooding. Implosive therapy is an advanced technique that involves desensitizing a client to a situation by having him, her imagine an anxiety-producing situation that may have dire consequences such that there is a massive implosion of anxiety. The client is not taught to relax first. With repeated exposure of stimulus in a safe setting, the stimulus loses its power to elicit anxiety and the neurotic avoidance behavior is extinguished. It is also called as in vitro, lab, clinic setting desensitization. Flooding or in vivo is less traumatic as the imagined anxiety-producing scene does not have dire consequences. It can be used for people who cannot imagine scenes realistically. For e.g., a client with a phobia of heights may be taken to the terrace of a building. Hence the client is made to realize that feared consequences do not occur. It is a simple treatment of choice for simple phobias. Systematic desensitization. It is designed to help overcome anxiety in particular situations. The term systematic refers to the carefully graduated manner in which the person is exposed to the feared stimulus. A client is asked to describe the situation that causes anxiety and then rank the situation and related events on hierarchical scale from least to most anxiety-provoking event. The client is taught to relax physically and mentally. The client is then exposed to situations which are least provoking and learn to relax at the same time. Since anxiety and relaxation are antagonistic, the client will experience either one. This is done till he is relaxed in the first situation. The therapist then moves on to the next anxiety-provoking situation. This is done till he masters the task of staying calm and relaxed even in most anxiety-provoking situation. The sessions conducted are usually for 30 minutes and often 2 to 3 times per week for a number of weeks or months. Sometimes it is used in groups referred as marathon desensitization groups. Aversion therapy. Aversion therapy involves modifying undesirable through punishment. It involves either the removal of desired reinforcers or the use of aversive stimuli. The basic idea is to reduce the temptation value of stimuli that elicit undesirable behavior. It can be done through use of mild electric shocks or drugs. It is Psychology paper number 15, Clinical Psychology. Used mostly for smoking, drinking, overeating, drug dependence, gambling, sexual variance and bizarre psychotic behavior. Modeling. It involves learning of skills through imitating the behavior of others. Usually the parent, therapist or peers perform the behaviors and the client observes and imitates the behavior. For e.g., a child suffering from mental retardation may be taught self-feeding through modeling. The terms modeling, observational learning, imitation, social learning and vicarious learning all refer to process by which behavior of an individual or group acts as a stimulus for similar thoughts, attitudes and behavior on the part of the observer. Bandura outlines 3 effects of modeling. First is the acquisition of new responses or skills in the performance of them. E.g., learning the skills in sports, language patterns, training autistic children to speak to through the use of models, social skills and teaching hospital patients coping skills necessary for their return to the community. The second effect is inhibition of fear responses, which occurs when the observer's behaviors are inhibited in some way. Here the model averts the negative consequences of have positive consequences. E.g., handling snakes and not bitten by it, performing feats and not getting hurt. Also workers who strike and do not lose job, then others may follow the same. The third effect is a facilitation of responses in which model provide cues for other to emulate. The effect is to increase behaviors that the individual has already learned. E.g., attractive teenagers advertising for jeans. Others watching may follow the same fad. Also for e.g., when person who leaves a social gathering, other follow the same. Systematic use of reinforcement. Reinforcers are those events that, when they follow a behavior, increase the probability of the behavior repeating. It may be positive or negative. Reinforcers can be effectively used to elicit and maintain behaviors. Schedules of reinforcement. When a behavior is first being learned, it should be reinforced every time it occurs, i.e. continuous reinforcement. After it is established, intermittent reinforcement is given. Schedules of reinforcement operate according to either number of responses, ratio, or the length of time, interval, between reinforcers. Both ratio and interval are either fixed or variable. Response shaping. A behavior learned gradually in steps through successive approximations is known as shaping. When clients learn new skills, counselors may help break down behavior into manageable units. Token economies sometimes intangible reinforcers are ineffective. Hence, tangible may be used in the form of tokens that can be exchanged for desired objects and privileges. It has been used to establish adaptive behaviors ranging from elementary responses, such as eating and making one's bed, to the daily performance of responsible jobs. Tokens have the advantage such as, a. The number of tokens earned depends directly on the amount of desirable behaviors. B. Tokens, like money, have value in the outer world. C. Tokens can reduce the delay between appropriate performance and reinforcement. It has been effective in managing behavior of patients with chronic schizophrenia and mental retardation. Behavioral contracting, also called as contingency contracts. These contracts spell out the behaviors to be performed, changed or discontinued in writing. The rewards associated with the achievement of these goals and the conditions under. Psychology paper number 15, Clinical Psychology. Which the rewards are to be received. It is helpful as the structure of the treatment is. Statement: the responsibility of client are outlined and system of rewards is built in. The length and focus of sessions are specified and the criteria for determining success or failure can be seen. Assertiveness therapy: it is based on the idea that a person should be able to express his thoughts and feeling appropriately without feeling undue anxiety. The technique consists of counter-conditioning anxiety and reinforcing assertiveness. The client is taught the difference between passive, aggressive and assertive. In the therapy, the desired behaviors are first practiced in a therapeutic setting. Then through the therapist's guidance, the individual practices new behaviors in real-life setting. It focuses on developing appropriate and effective interpersonal skills. Biofeedback treatment: the physiological responses such as heart rate, galvanic skin response and blood pressure are involuntary. In this approach, a person is taught to influence his or her own physiological process. It involves the following steps: A. Monitoring the physiological process that is to be modified. B. Converting the information to a visual or auditory signal. And C. Providing a means for feedback. Looking at the feedback, the subject then reduces the undesired anxiety or response. It requires investment of capital to purchase complicated equipment. Although there is some agreement on the effectiveness of this approach, however, some researches claim that the results are often small and not generalizable to other situations. Some principles of learning and their meanings. Generalization: it involves display of behavior in environments outside where they were originally learned, e.g. home, at work. It indicates that transference into another setting has occurred. Maintenance: it is defined as being consistent in performing the behavior without depending on anyone else for support. Here emphasis is on client's self-control and management. It is done through self-monitoring, involving self-observation, requires a person to notice particular behavior he does, and self-recording focuses on recording of particular behavior. Rehearsal: it consists of practicing a desired behavior until it is performed the way the client wishes. Covert sensitization: it is a technique in which undesired behavior is eliminated by associating it with unpleasantness. 6. Evaluation of behavior therapy. 6.1 Strengths. The approach deals directly with symptoms. Because most clients seek help for specific problems, counselors are able to assist clients immediately. The approach focuses on the here and now. A client does not have to examine the past to obtain help in the present. It is economical and saves both time and money. The approach offers numerous techniques for counselors to use. Psychology paper number 15, Clinical Psychology. The approach is based on learning theory, which is a well-formulated way of documenting how new behaviors are acquired. The approach is supported by extensive research on the effectiveness of its techniques. The approach is objective in defining and dealing with problems and demystifies the process of counseling. It has well-established empirical evidence of its effective treatment of chronic pain, panic disorder, generalized anxiety disorder, phobias, OCD, tension headaches, irritable bowel syndrome, female orgasmic dysfunction, male erectile dysfunction, etc. 6.2 Limitations. The approach does not deal with the total person, just the explicit behavior. It changes behavior but not the feelings. The approach is sometimes applied mechanically. The importance of the relation between the client and the therapist is ignored. The approach is best demonstrated under controlled conditions that may be difficult to replicate in normal counseling situations. The approach ignores the client's past history and unconscious forces. It does not provide insight. Some clients want not just to change behaviors but also gain understanding of why they behave the way they do. The approach does not consider developmental stages. It treats symptoms rather than causes. It involves control and manipulation by the therapist. The approach programs the client towards minimum or tolerable levels of behaving, reinforces conformity, stifles creativity and ignores client needs for self-fulfillment, self-actualization and feeling of self-worth.